Hi all. I'll be talking about the glycemic index of common foods and how it affects the dietary patterns of a diabetic patient. Glycemic index is a score that starts from 1 to 100 and it classifies the various different type of carbohydrate foods that are available based on low, medium and high glycemic index. That is how much it raises the blood sugar or how rapidly it raises the blood sugar when you consume a carbohydrate. That is what is meant by a glycemic index. And so the rapidity of increase in blood sugar is highlighted whether you take a high glycemic index or a low glycemic index food. So glycemic index is divided into low glycemic index, medium glycemic index and high glycemic index. Any glycemic index value of less than 55 is low, above 70 is high. And the major concern or major concerns highlighted by every patient is the glycemic index of different types of rice and the glycemic index of wheat. A whole grain, be it rice or wheat, will have a lower glycemic index when you compare to its polished counterparts. Oats, barley, all these have low glycemic index, and when you consider different rice, varieties of rice, brown rice is the one with the lowest glycemic index, followed by long grain basmati rice, then parboiled rice, and rice with the highest glycemic index is the polished white rice that you use as staple food for cooking boiled rice or used for making idlis and doshas. That is, this white rice contributes to the maximum glycemic index of up to 80 to 85 percentage. And though 100 gram of rice and 100 gram of wheat give the same 350 kilocalories, if you consider a whole grain wheat that is rich in its bran, that can produce a lower glycemic index and less rapidly rise in blood sugar values. So be conscious of the glycemic index of different types of food. Count your calories before taking food. All these lead on to an acceptable level of blood sugar values, which will help in achieving a long-term glycemic control for you. Thank you.